Brian and Barry, I get asked as the university president, why am I so excited about this thing? I'm not going out there and practicing. Why am I so excited about it? But from an academic point of view, this just didn't exist 6 or 7 years ago. And now suddenly we have the potential to change lives. We have the potential to change how people live and are taken care of in this state, how they're educated, the future of medicine, and I find it incredibly exciting as a university president.
Well, I have to tell you, Bob, we at RWJBarnabas Health feel precisely the same way. From our standpoint, to optimize our ability to pursue our mission, this relationship is transformational. It does create, as you have said, a unique organization for New Jersey, and I think nationally will be a destination for folks. So it infuses our organization and galvanizes its energy and excitement like none other.
This is really a perfect alignment, a perfect synergy between the two organizations. We remain separate, the boards remain separate, our faculty remain faculty, our faculty still report to their chairs, the chairs report to the deans report to the chancellors. We've protected the academic culture. Our employees remain Rutgers employees, the Barnabas employees remain Barnabas employees, and yet we have come up with a structure that allows complete alignment.
There are equal benefits on both sides. It's not two organizations that have to step on each other's toes in order to get close enough together to work together. We fit together so well as a group that we bring to the table synergistic strengths. And if we just do what we do better than we do it now on both sides, the success of the operation is almost guaranteed.
This is an enormous opportunity for us from a research point of view. We already, as we talked about, Rutgers is already by far and away the largest research engine. In New Jersey, it has more research dollars than all of the rest of the universities in the state put together. This will double what we can bring to bear. A clear, obvious example of this is CINJ, the Cancer Institute of New Jersey. It is the only National Cancer Institute designated cancer center in the state of New Jersey. And with the partnership with Barry, we're going to be able to markedly expand access to the most high-end treatments here in New Brunswick, while at the same time expanding across the state access to all of what CINJ has to offer.
I think that's right, Brian, and I think the Cancer Institute, Rutgers Cancer Institute of New Jersey is a perfect example. We have selected, of course, that Cancer Institute to be our oncology clinical product line throughout the system. So there is a seamless integration. My colleagues throughout the country have spoken to me about what we're doing with Rutgers University, and I think we've each experienced the fact that physicians from outside of New Jersey have solicited us to want to come to be part of this exciting initiative. And folks are wanting to relocate into an environment where they know there will be sufficient resource to support research and sufficient clinical activity so that they can conduct both practice and research.
Well, I have to tell you, Barry, as I look at the faculty who are interested in coming now, these are world-class people coming from world-class institutions. And each one that comes ups the ante. Each one that comes makes it even more attractive for other people to say, what's going on there? I mentioned in the beginning how excited I am about this, and I have the opportunity to step back a little bit because I'm not the one that's actually implementing it. But I see this as an opportunity for a new state of healthcare for the citizens of New Jersey, a new state of healthcare for the nation, and frankly, an example of how healthcare can be delivered for the world. I don't know if you share my enthusiasm for that? Or?
Well, of course I do, and I'll tell you, that's not a Madison Avenue slogan. That is in fact, was and is the principal motivation for creating this. It will be a new state of healthcare for our state and the nation. And we will continue to improve on that as we go along. And that's what really fuels all the excitement, frankly, from our organization.